So what causes liver disease? I'm sure a few points we've already discussed here. But is there anything else that you would like to?
Yeah, I would like to point out that there are while there are many, many types of liver disease, only 3 or 4 diseases account for over 90% of all liver disease. And much of it is self-induced. So alcohol is number one. Harmful amounts of alcohol consumption, which is defined by more than 2 to 3 drinks per day, definitely can contribute to liver disease. From a overall health perspective, there is no amount of alcohol consumption, even 1 drink a day, on a regular basis that is healthy, because it has been linked to cancer risk, particularly breast cancer. And so alcohol is a toxic molecule, but it's ingrained in many aspects of our culture. So if you cannot live an alcohol-free life, at least drink in moderation. What is particularly bad is binge drinking, where you have more than 4 to 5 drinks in one sitting. And particularly if you binge drink more than, binge drinking is just bad. So I'll just leave it at that. In addition to alcohol, the next thing is our diet. So the amount of food we consume has to be matched to our exercise and our body's needs. Because the purpose of eating is, 1, to provide nutrition to our body, and number 2, there's obviously a hedonistic, a joyous aspect of eating. So while we get the joyous aspect, control, everything in moderation. So Buddha said, live in the middle path, right? Don't go crazy this way, don't go crazy that way, find your truths in the middle. It's such a great life truth that find that moderation in your life. Nobody says you don't eat this, and don't turn your eating habits into some crazy thing where you say, oh, I can only have this and I will never touch that. Our body, we like different types. We are hardwired to like different types of tastes and flavors and foods, and embrace that, but watch portion control. And then don't go crazy in any one direction. The word in lifestyle is the word life. The way you live has to be sustained for your life. Making huge changes, which you cannot take more than a few weeks and then you lose, really doesn't help you in the long term. The point of this is to live a longer life. And for that, whatever you do has to be sustainable over the course of your life.
That's how the New Year resolutions never work. Because I think
they are too extreme, and they're not sustainable. Making small changes that are sustainable, make those changes as a family. If one person in the family changes in a certain way and the others are still living in another way, which is unhealthy, frequently the individual person perceives that they are being punished because they are being asked to eat a diet which maybe doesn't give them the same pleasure as the unhealthy diet, because for some strange reason, everything that tastes good often is not great for you from a health perspective. So you have to exercise moderation. So when the whole family makes a change, it's much more sustainable. So also then brings the whole family together. And when the whole family is together and happy, you're going to be happier mentally. And if you're mentally happier, then that will translate into better health for you. And then it'll affect your metabolic health as well. So that's how you connect the dots all the way to the liver.
Correct. And I think the homemaker or the lady of the house can make an impact to a great extent, where if she encourages, a healthier way of living, not keeping processed food at home, the soft drinks, the cold drinks and things like that, because it has huge amount of sugar and so on. So it starts from the home, I think.
Absolutely, because simple things you can do is cut out the sugary beverages. Anything that contains this sugar called high fructose corn syrup, avoid those, because those get turned straight into fat. And they sort of bypass your normal metabolic channels. And so they are particularly bad for you. Avoid this fried, crispy, deep fried stuff, things with refined sugars. increase things that have more fiber in them. Make sure you're getting adequate protein to make sure your muscles are healthy, So you can make these changes, and there are so many options. Today in 2024, everybody is internet connected. You go on YouTube, you'll find dozens of options of cooking very interesting meals, which are also healthy. And then if you embrace this as a family, as a way of culture and a way of life, without losing the kind of foods and the tastes that you grew up with, then I think the whole family can be healthier. And by doing these simple things, these are preventive things, right?
Right.
That reduces the need that one day we'll be having a talk about using high-tech stuff to do a liver transplant or do something very complex at high cost, and all of which comes with, there are many, many issues linked to all of those.
Yeah. During our conventions that we hold for WELCON, we price the ticket at a very minimal amount, sir. And that's basically so that they are committed to attend the convention, which showcases all these aspects of how you could live a happy life, a healthier life. However, I have seen that at times when people reach the hospital, they will be folding their hands, requesting the doctor, please save our child, please save our parent or a spouse, or if I go on and that. But they're not willing to spend a little amount of money to take basic education and how they could look after. What are your thoughts on that, sir?
Well, I think it's sad when that happens, because every time somebody comes into the hospital with very advanced chronic liver disease, that means they have failed themselves, their family has failed them, and the medical system has failed them for a decade or 2 decades and allowed them to get to this point, because all of this is potentially preventable. And so think about your own culpability in the health of your family. For parents, I would say think about the health of your children. You think, oh, they're kids, nothing will happen, then let them eat because this is their time to eat, but it will catch up with them. So diabetes is a disease that we used to think about our grandparents. Then we saw it in our parents. Now we have a generation, we're seeing it in our children. So I'm not diabetic, but my child may be diabetic. And this is not an uncommon story that we are seeing. And we are at serious risk of losing an entire generation from diseases that we attributed to old age, but really happening to our younger generation. So this is extremely important. I cannot overemphasize the seriousness of this epidemic of diabetes, cardiovascular disease, liver disease, and it's all happening in the same individual. So it's like you're going to get punched from 6 different directions. Your kidneys, your diabetes, blood sugar, your heart, your liver, all of these will give out together. And so your best hope is to live a healthier lifestyle, get those regular annual health maintenance checks, manage the risk for all of these organs, talk to your doctor about the risk from all these organs, and develop a more holistic approach to living a healthier life with your family. It's not just a matter of your quantity of life. It's also the quality of life. And the healthier and the fitter you are, you will be able to enjoy all the wonderful things life has to offer to you.
Absolutely. So which is the most common liver disease you come across?
So the most common is something called steatotic liver disease or fatty liver disease. We don't like to use the word fatty anymore because, it is perceived as sort of insulting word because of popular perception, even though the liver is full of fat. So steatotic liver disease is really a condition where the liver accumulates fat. It is closely associated with our global pandemic of people with increasing obesity and, and in Asia and in India, many people, when you look at them, don't necessarily look obese, but they carry all their fat inside their abdomen. that is called visceral adiposity. And visceral adiposity is particularly dangerous and is linked to heart disease, diabetes, and also liver disease. And so this is the most common one.
So that means this is the first sign.
Well, adiposity puts a risk factor for developing the liver disease. There are other liver diseases with alcohol plays in that role as well. But also there are pockets of places where there are still viral infections, virus infections of the liver, which are potentially highly treatable. Hepatitis C is essentially curable, and hepatitis B can be controlled in virtually everybody nowadays with the drugs that we have. And while there's more to be done in hepatitis B, we have very effective drug therapies for all of those. So really, getting tested once for viral infections of the liver, and if you have it, getting it treated. I know that in India, the government actually provides access to care and treatment for viral hepatitis.
Yes.
So take advantage of that. Minimize your alcohol consumption and live a more healthier lifestyle. Get your annual checkups. And I think that is really the message to keeping a healthy liver, and which will result in a healthy body and a healthy life.
I have just a couple of quick questions. One, lately I've been seeing that people are popping pills off and on, or taking tonics, liver tonics, and so on. And they feel that, okay, I've had a couple of drinks, and if I have pop up some pills inside, I should be fine. It doesn't affect. What would your thoughts be on that, sir?
You know, there are two types of medicine. There's evidence-based medicine, and there's non-evidence-based medicine. So around the world, we try to practice medicine that is supported by evidence. So we know that the recommendations we are making are backed up by actual science and not just beliefs. What we've learned over the last 100 years particularly is that when medicine or surgery is practiced based on the beliefs of an individual doctor or person, they're frequently wrong. And so that results in the potential for harm. And so from that has evolved this concept that medical practices need to be supported by evidence. In the modern medical world, there are very clear guidelines about the type of evidence that is needed to be able to say this works in this setting. And the bar is set quite high because the first principle of medicine is to do no harm. And so safety is number one. And then once you've established something is safe, then you have to establish that it actually works and benefits somebody. So these products have, by and large, little or no evidence by the standards by which we review all other medical interventions to support their use. They can occasionally also be toxic. So based on data in the US, where there's a national tracking system of people who come in with acute liver failure. This is a condition where the liver suddenly just melts away and you're literally, on the verge of death. And a substantial portion of those are actually due to natural products that people consume, thinking these are health products. Yeah. And because it's a natural product, it must be good for you. But remember, Dhatura is a natural product. Foxglove is a natural product, but they will kill you with certainty. And so just because something exists in nature doesn't mean it's good for you. So you have to be cognizant of that. You have to be careful about what you put in your mouth. Remember back to the concept of mindfulness. Absolutely. And then really having a conversation with your doctor about the risks and benefits of the kind of medicines you take. You know, taking things because of cultural beliefs is one thing, but the safety of some of those things you should really discuss with your doctor before you make it a habit.
Thank you so much, sir.